So today we are going to discuss the Norma basalis, or the base of the skull. For convenience of study, the base of the skull is further subdivided into three parts: anterior, middle and posterior. The anterior part includes the hard palate and the alveolar arch. The middle part is this is foramen magnum. An imaginary line is drawn till the anterior border of the foramen magnum. So this is the middle part of the Norma basalis, and this is the posterior part of the Norma basalis. So we'll discuss these one by one. First of all, we'll discuss the anterior part of the Norma basalis. So the anterior part of Norma basalis has this dome-shaped area called the alveolar arches. These are the sockets for teeth. Then this is the hard palate. The hard palate is formed by two bones. Anterior 2/3 is formed by the palatine processes of the maxilla, and the posterior 1/3 is formed by the horizontal plates of the palatine bone. So we have sutures between these, three sutures in this area. This central suture is between the two palatine processes of maxilla. So this is intermaxillary suture till here. This one is between the horizontal plates of the palatine bone. So this is interpalatine suture. And this one is the cruciform suture between the maxillae and the palatine. So maxillopalatine suture, this one. So we have three sutures in the hard palate. Then there is a fossa called the incisive fossa. It has two canals, the right and left incisive canals inside it. Then we have, just behind the palatomaxillary suture, we have a foramen called the greater palatine foramen. As you can see, this one is the greater palatine foramen. The greater palatine foramen, there's a groove that leads from the greater palatine foramen towards the incisive fossa. As you can see, this one is the groove. Then just behind the greater palatine foramen, we have 2 to 3 small lesser palatine foramina. These are the lesser palatine foramina. Then the posterior edge of the palatine bone presents a spine called the posterior nasal spine. And the free edge of the palatine bone is called the palatine crest. This one is the palatine crest. Posterior nasal spine and the palatine crest. So this is the anterior part of the Norma basalis. Now coming to the middle part of the Norma basalis. Its extension is from the hard palate anteriorly till an imaginary line drawn at the anterior margin of the greater foramen magnum. So this part is the middle part of Norma basalis. We divide it into a median area and a lateral area. In the median area, we have vomer and a broad bar of bone that is formed anteriorly by the body of the sphenoid and posteriorly by the basilar part of occipital bone. So this is vomer. It divides the posterior nasal apertures. This is vomer. These are the two ala of the vomer. In this area, we have two canals, the palatino-vaginal canal and the vomerovaginal canal. The lateral border of the ala overlaps with the vaginal process of the medial pterygoid plate to enclose a canal that is called the vomerovaginal canal. This one. This is the vomerovaginal canal. And the vaginal process of the medial pterygoid plate, this is the pterygoid plate, the medial pterygoid plate and the lateral pterygoid plate. The vaginal process of the medial pterygoid plate here, along with the sphenoid process of the palatine bone, forms another canal that is called the palatino-vaginal canal. So these two canals, the vomerovaginal canal and the palatino-vaginal canal, these are located in the median area of the middle part of the Norma basalis. Median area also presents a tubercle called the pharyngeal tubercle that is located on the broad bar of bone in the center. This is the pharyngeal tubercle. The lateral area of the middle part of Norma basalis includes two parts of the sphenoid bone, the pterygoid process and the greater wing of sphenoid, this one, the pterygoid process and the greater wing of sphenoid. This area also includes three parts of the temporal bone: the petrous temporal bone, the tympanic plate, and the squamous temporal bone. So in the lateral part of the middle part of Norma basalis, we are going to discuss these 5 things one by one. The pterygoid process is part of the sphenoid bone. The pterygoid process has a medial pterygoid plate and a lateral pterygoid plate. The medial pterygoid plate and lateral pterygoid plates, these are connected anteriorly, and posteriorly they are separated to enclose a V-shaped area called the pterygoid fossa, this one. So this is the medial pterygoid plate, this is the lateral pterygoid plate, and these two are separated posteriorly to enclose a V-shaped pterygoid fossa, this one. Anteriorly they are connected. The pterygoid plates are connected medially with the perpendicular plate of the palatine bone, and laterally they are separated from the body of the maxilla through the pterygomaxillary fissure, this one, pterygomaxillary fissure. Now let's discuss the medial pterygoid plate. The medial pterygoid plate posteriorly presents a fossa that is called the scaphoid fossa, this one. This is the scaphoid fossa. It has a free posterior border, a medial surface, and a lateral surface. The lower end of the posterior border of the medial pterygoid plate presents a humulus called the pterygoid humulus, this one. This greater wing of sphenoid is pentagonal. Its anterior margin is formed by the posterior border of the inferior orbital fissure, this one. Anterolaterally, it articulates with the infratemporal crest here. Posterolaterally, it is communicating with the squamous temporal bone. Then coming more medially, it articulates with the petrous temporal bone. And anteromedially, it is continuous with the pterygoid process here. So this is the area of the greater wing of sphenoid. It presents various foramina. The lateral pterygoid plate ends at the level, the posterolateral end of the lateral pterygoid plate presents an oval foramen that is called the foramen ovale. It is oval in shape, this one. This is the foramen ovale here. Then just behind or posterolateral to the foramen ovale is another foramen that is called the foramen spinosum, this one. This is foramen ovale and this is foramen spinosum, the circular foramen just behind the foramen ovale. Just behind the foramen lacerum is the spine of the sphenoid, this one. This is sulcus tubi. It lodges the cartilaginous part of the auditory tube. This is apex-shaped petrous temporal bone. It presents a foramen called the carotid canal, this one. This is the carotid canal. This one is the foramen lacerum. This is short and broad, which is bounded laterally by the petrous temporal bone and medially by the basio-occiput. This is the tympanic part of the temporal bone, also called the tympanic plate. Its apex ends towards the spine of the sphenoid here. The anterior surface forms the posterior wall of the mandibular fossa. The posterior surface forms the posterior wall and floor of the posterior border of external caustic meatus. Then is the squamous part of the temporal bone. It forms the anterior wall of the mandibular fossa, where the mandible articulates and forms the temporomandibular joint. Then it also forms the articular tubercle, which is present on the zygomatic process. The posterior part of the Norma basalis extends from the anterior margin of the foramen magnum till the posterior side. So this is the posterior part of the Norma basalis. In the posterior part of the Norma basalis, we divide it into a medial area, median area, and two lateral areas. The median area has the large foramen magnum, which is this largest foramen of the skull. This is foramen magnum. It is narrow anteriorly and broad posteriorly. Then the next thing is the external occipital protuberance. This is a prominence in the posterior area of the Norma basalis called the external occipital protuberance. Then there is this crest called the external occipital crest, which begins from the posterior margin of the foramen magnum and it extends till the external occipital protuberance. So this is the external occipital crest. And then we have the nuchal lines. The nuchal lines start at the level of external occipital protuberance. This is the superior nuchal line, and at the level of the middle of the crest is the inferior nuchal line. The highest nuchal lines are sometimes present above the superior nuchal lines. So these four things, the foramen magnum, external occipital crest, external occipital protuberance, and the nuchal lines, they form the median area of the Norma basalis posterior part. Then coming to the lateral area of the Norma basalis posterior part, we have the occipital condyles. These are the condylar parts of the occipital bone. Then the squamous part of the occipital bone, which includes the nuchal lines, the superior and inferior nuchal lines. Then we have the this jugular foramen, this area, jugular foramen, the styloid process. These are the styloid process and the mastoid process of the temporal bone. So we are going to discuss these one by one. First of all, the occipital condyles. The occipital condyles are parts of the occipital bone. Just anterior to the occipital condyle is an anterior condylar canal or the hypoglossal canal, this one. Here, this is the anterior hypoglossal canal or the anterior condylar canal. This is just in front of the condyle, the occipital condyles. Then just behind the condyles we have a posterior condylar canal or simply the condylar canal. This is at the base of the occipital condyle posteriorly. Then we have the jugular process. On the lateral side of the occipital condyle we have a process that is called the jugular process, which is forming the posterior boundary of the jugular foramen. This one is the jugular foramen. This is the jugular foramen. Next we have the styloid process. Styloid process is a needle-shaped process. It is part of the temporal bone, the styloid process. Here, this is the styloid process of the other side. Then at the root of the styloid process, we have a foramen, the stylomastoid foramen. This is the stylomastoid foramen. This one. This is the mastoid notch. Just behind the stylomastoid foramen is the mastoid notch. And this projection is called the mastoid process. It is part of the temporal bone. So mastoid process is on the lateral side of the mastoid notch. Just anterior to the mastoid notch is the stylomastoid foramen. This is the styloid process, the jugular foramen, the condylar parts of the occipital bone, the posterior condylar canal, the anterior condylar canal or the hypoglossal canal, the foramen magnum, external occipital crest, external occipital protuberance, superior nuchal lines and the inferior nuchal lines. This is the posterior area of the Norma basalis.